Hello, everybody. What is going on? Thank you so much for tuning in to the Queen's Lounge podcast. Welcome to the lounge. I am your homegirl, Shay. And of course, I have a special guest with me on today, Miss Johnessia Jackson. I am so excited for her to be a part of the podcast today as my guest. She is going to be talking about the benefits of therapy. I first met Miss Johnessia. I was looking for someone to come and speak at my event that I had in June about complications with fertility and women that suffer with PCOS and underlying medical conditions that lead them to have infertility problems. And she was one of the guests, and she actually spoke about being the emotions of going through infertility. It was an honor to meet her for the first time. When she came in, she lit the room up. It was such an honor to hear everything that she had to say. She was so knowledgeable about things and tools that us, the women that were there, can use to kind of get us through this transition of dealing with infertility. So she had a lot of nuggets that she gave, and today is no different from June. So I'm going to give her the floor so that she can introduce herself, let you know who she is. So Miss Johnessia, it's on you.
Hello, everybody. As Shay said, I'm Johnessia. I am a licensed clinical social worker. I do have my own part-time private practice called Convergence Counseling Services, and it is a pleasure and an honor to be here today.
Awesome. Well, Miss Johnessia, we are going to go ahead and get started. Now, I know that therapy is a crucial part of people's lives. I know several people personally who have either started their counseling sessions, who have been doing it for a while now, who are after a pandemic or after suffering, a loss or something like that, where they have dived a little bit deeper into therapy, and it has been very therapeutic for them. I know that everybody kind of has an outlet depending on where they are in their lives, what they're going through in their lives, but everybody has something that they consider an outlet where they can just release. And therapy seems to be one of those things that is a tool or a part of people's lives to give them the opportunity to relinquish whatever it is that they're carrying. So let's get into some questions, shall we?
Yeah.
Now, the first question that I have for you is, what are some of the misconceptions about therapy?
So I think there's probably a long list of misconceptions.
I'm sure.
When it comes to therapy. I think probably one of the biggest ones, especially for the Black community, is this notion that you got to be crazy to participate in therapy or to need therapy. And that is most certainly not the case. You can have therapy for a gamut of reasons, and it does not mean that you're crazy.
Yes.
I think another misconception is, for a lot of us, we do have good support. We have friends, we have families, and we feel like those are the people we can share our problems or troubles with, which, yes, that's absolutely true. But with therapy, it dives a little bit deeper, making connections and helping you yourself to see how things can be different or how you can make changes in your life. So I think those are probably two big ones. And then, of course, when we watch TV shows and see how therapy is done on TV, is not necessarily what's real or what's really done in a therapeutic setting or in an office. So, lots of times we see people lay back on a couch, And so can you, when you come to my office, can you lay down on the couch? Absolutely. But it's really not that. You can sit there, be comfortable, cry, talk, do whatever it is you need to do within your session to begin to make the changes that you want to see in your life.
One thing that I'm glad that you pointed out is that a lot of us are very comfortable with going to family and friends because that's our comfort space. And I think therapy is something that's uncomfortable for most people. You know what I mean? It's something that is unusual, and it's something that we're not used to doing. And I think a lot of the times when it's something that is out of our norm, we're very resistant against it. And I like to be very honest in actually going to go see somebody that doesn't know me because for one, they're not going to be biased. And for two, they have no attachment, no connection, no relationship with me. It's just me literally laying everything out on the table to get whatever it is that I need to get off of me. You know, I feel like sometimes when going to family or friends, it's kind of like a blurred line, because sometimes they can side with you when you're wrong. Sometimes they can pity pat when they really need to be honest and really need to tell you the truth. And I think a therapist is just no bars held at all. Like, I'm just going to give you the real, because that's what you pay me to do. So I'm just going to be completely honest with you. So I'm glad that that was something that you mentioned, because I think that's a really good point. Okay, so number two, what is therapy for?
Oh my goodness, therapy can be for various things. It could be for grief and loss. You could be having marital issues. You could want premarital counseling. Maybe you have anger issues and you need to work that out in therapy. Maybe you're on the opposite end of that and you bear the brunt of the anger issues of someone else. If you're in, you know, domestic violence, verbal abusive situations, emotional abusive situations, trauma. A lot of us have,
Oh yeah, that's a good one.
A long history of traumatic things that have happened to us that we have never said out loud in most cases or talked about. And so those are all great things to be able to process and work through in therapy.
That's awesome. I love that. I've grown up in the church all my life. I'm a pastor's kid. And so premarital counseling was something that was very, it was something that was taught to me. It was something that I was told that I needed to do, to not necessarily set up this pre-notion of something going wrong in whatever it is that I'm doing, but to kind of prepare me for what I'm getting myself into. That makes sense. So I think a lot of people are scared to do premarital counseling. I don't really know why. I think a lot of people think that maybe, you know, something will happen, you know, during the premarital counseling, or they don't want to hear anything that the person is really feeling before getting married, you know, which is all the more reason why you need to go so that you can know what's going on prior to that.
Absolutely. And I think people are too scared of what might be uncovered that you know, are you be embarrassed that you didn't know a certain aspect of your mate before you got married that comes out in premarital counseling. But as you already stated, what a beautiful time to learn those things before you walk down the aisle.
It's definitely, because the last thing you want to do is find out something that you could have found out prior to saying I do, and spend all that money that you about to spend. Okay, the third question is, how does therapy affect your everyday life?
So some of the things that you learn in therapy definitely weaves into daily living. Some of the biggest things that I work with clients on in therapy is general coping strategies, right? What can you do when you're faced with a stressful situation at work? Maybe your emotions, you're overwhelmed by your emotions. You don't really know if you should react, how to react to the stress of work. Maybe you need to steal some time away, go to the bathroom, do some deep breathing, meditate quickly, or whatever to calm yourself down. So those are what we call coping strategies. Maybe, you know, you have this history of blowing up on folks or yelling at your kids or yelling at your husband. How can you take a few minutes to calm yourself down, regulate your emotions, and be able to communicate effectively with your children, your partner, your coworkers, your boss? So, you know, really simple things like that. And, you know, in terms of romantic relationships, some of the things you learn in therapy about how you've made connections in the past, you'll be able to change that for the future. So as you are making new relationships, you know the red flags, you know your boundaries, you know what you are not going to accept when it comes to other people being in your life. So just, you know, kind of simple things like that.
Okay. Now, correct me if I'm wrong. I'm glad that you mentioned the tools that therapists give to their clients or to their patients, because I think it's so important. And I think the more that you practice doing therapy and the more that you practice and implement the things that are given to you in your therapy sessions, the easier it becomes when you have those moments. You know what I mean? Because it's so easy to just spaz out. It's so easy to react. But then when you have those tools that kind of replace the reaction, I think kind of helps a little bit more. Because I cannot express enough how premarital counseling definitely helped. It definitely helped. I've never been one against counseling. It wasn't something that I ever considered personally, but it's always been something that I was told that was going to be important to my marriage. And so it was something that I wanted to take advantage of. And doing that led me to then want to get counseling personally just for myself. Because although I'm married and the premarital counseling was for the both of us, there still are things that I needed to deal with individually. Absolutely. There were still things that my husband couldn't fix. There were still things that, he didn't understand. So being able to, it was almost like a segue, premarital counseling being a segue into doing individual counseling for myself. So that definitely helped. So the tools that I've learned and that I've implemented in my everyday life has definitely helped. It has calmed, it has soothed, it has kept me, out of post and bond. So it's definitely, it's definitely helped a whole lot. Okay, good. Next question. Who is therapy for?
I say this all the time, and my really good friend, the model for her practice is, in fact, is that therapy is for everyone. There is no type, no color, no shape, size, whatever. It's for everyone. We experience things sometimes that we don't really think is traumatic or that affects us. But once you sit down and break those things down and talk with the therapist, you'll find how some of those minor things kind of weave their way into major things. And our experiences and our traumas is what shapes us. It's how we learn those maybe not so healthy coping skills based on some of the things that we've experienced. And so it's good to be able to sit down, talk to a non-judgmental, non-biased person and help you work those things out. Because what I found, excuse me, in seeing some clients, they may present for one issue.
Yeah.
You'll find the underlying issue is something that they've been experiencing their whole lives. So therapy is for everybody.
That's awesome. I love that, because I think some people think because they've made it to a certain point, and maybe that's another reason why they don't like to bring up things from the past, because it brings out it makes them have to sit and deal with what it is that they were not trying to deal with. Does that make sense? I listen to The Breakfast Club a lot, and I always hear Charlamagne the God say, if you don't deal with your trauma is going to deal with you. Absolutely. And therapy could not be more beneficial for a person that has experienced trauma. And like you mentioned, that's everyone. Everyone has witnessed something traumatic in their lives that has either caused them to kind of like shut everything else out, or to not really sit and deal with what it is that they need to deal with. I think fear is another reason why a lot of people don't like to do therapy either. They get fearful and, of the unknown, not really knowing what's going to happen. I hear a lot of people also say that they don't like to do therapy because they don't feel as if they need to relinquish all of their personal business to somebody they don't know. But to me, you relinquish it to people you do know. And how does that work? And how does that work out for you?
How's it working? Right.
Yeah. How does that work out for you? At least you won't have to worry about your business coming back to you completely different than the way you said it.
Right. And you have the opportunity to work with a trained, and I stress trained professional to be able to help you work through those things. Not that it's a therapist's role to give you advice or tell you what to do, but us asking you the right questions using what we call evidence-based practices or treatments, meaning these treatments have been studied and found to be effective in working with various traumas or experiences. And so why not be able to sit down and take advantage of that opportunity?
Yes, I think it's very needful. and especially now, right today. Okay, so my next question is, how do you know therapy is working?
Ooh, I love this question. I think probably the biggest way to know that it's working is you yourself seeing the small changes that you start to have. So maybe you present to therapy because you're angry all the time, you don't know how to communicate, it takes nothing for you to snap and blow up.
Right.
And as you have learned how to communicate better, how to regulate your emotions, when your 7-year-old or your teenager sets you off at home, instead of cussing them out, maybe you say, okay, tell me more about why you are feeling this way. Like, you start to ask them the right questions and have the right conversations with your kid. So you start to notice yourself the small things that are starting to change. Other people will also notice, right? If you're that difficult coworker in the workplace, other people, you may start to get compliments on how well you're doing your job or how well you handled a difficult situation. So other people will notice the changes in you as well. And lastly, I'm going to say, especially in terms of your family dynamics, people that live in the household with you, when you start to change, it's a domino effect. You will probably notice that your husband responds to you differently.
Right.
You will probably start to notice that your kids are starting to respond differently and handle situations differently. So you become that model in your family, and everybody catches on and gets on the bandwagon of this change that you're going through.
That's a really good. One of the ways that I knew that therapy was working for me is because I started to notice patterns. And when I say patterns, I started to notice things that I was doing in every relationship that I was in, not just with the opposite sex, but any relationship, family, friends, the opposite sex. I started noticing patterns. And then I always had to think to myself, okay, well, I got to be the common denominator, because for whatever reason, there's a problem and it's never working out, or it's always an argument, or we always being combative. Then is it really me? And sometimes that's a hard pill to swallow when you realize that it's you. You know what I mean? And all this time people have been telling you is you, and you ain't really, it ain't clicking. Something with you and something with them, it just ain't working out. So when I noticed that it was no more combativeness, there was no more arguing, there was no more going back and forth, there was no more, kind of pushing against the grain, but I started to notice it was almost like it's almost like second nature. Like, I recognized the patterns that I didn't want. And then when I started implementing the tools that was giving to me to get what I do want, it was almost like an instant change. Like, you couldn't even get the reaction that you were looking for because I had already implemented the tools I was given. So that's how I noticed, okay, this guy ain't working out. Okay. My therapist is on to something because it's working out. I feel like I'm getting where I need to get. So that's how I knew it was working out. So it's very imperative. And I think that people want to see results as well, but then you can't just leave it all up to the therapist. You got to do the work. Exactly. You definitely have to do the work. It's one thing for them to give you what you need, and it's another thing for you to actually put it into action. So that's definitely awesome. Okay, so the next one is, why is therapy important?
I think it's important so that we don't repeat the same negative thought patterns or repeat the same negative actions, so that we, especially in terms of generational cycles, that some of those things stop with us. And so that's where therapy would be important. If you think about your family, and even culturally, as a culture, we have a long history of traumatic events in our culture. And the coping mechanisms that we developed as a people, it gets passed down from generation to generation. And at some point in the generations, we don't even understand why we do the things that we do. We do it because mom and daddy did it and grandma did it, but that doesn't make it right or wrong.
Exactly.
So it's important to, dive deep into understanding, well, why do I react the way I react? Why do I attract a certain type of guy or woman that I attract? And so those are things you can process and be able to work out in therapy. And, in terms of trauma too, again, a lot of the things we do is because of our experiences. We've learned how to protect ourselves and put this hard shell on because of some of the experiences that we've had. So so it's important to work through and talk about what we've experienced, so we can start to shed the layers of that trauma and those coping mechanisms that we've developed as a result of the experiences and the traumas that we've endured.
Mm-hmm. That's some good info. Okay, so here's my next question. What are the different types of therapy?
Yeah, so let's kind of start with, you can do individual therapy, there are group therapies, there's couples therapy, and there's family therapy. And with that, there are also certain therapeutic treatments. So there are people who do cognitive behavioral therapy. There are people that do solution-focused therapy. You can do EMDR, which is eye movement desensitization and reprocessing, which is a great treatment for people who have experienced trauma.
Oh, wow.
There's lots of options in terms of, what treatments you can receive in therapy.
Okay. And I knew a couple of those you mentioned, but I never knew there was so much therapy. And I would want to assume that there are so many different categories of therapy because of each need that a person may have.
Mm-hmm. Yeah, there's different categories, and different therapists decide to be trained in whichever therapeutic treatment that they feel maybe best fits their style, based on their own experiences and based on their specializations. So if I am, a strictly trauma therapist, then I may want to be trained in EMDR, or brain spotting is another one.
Okay.
And so kind of segue into, making sure, you do your own research if you're interested in therapy in terms of what's out there. So when you are meeting therapists, you are able to ask, hey, what treatments do you provide, or what do you think is best for my situation? So you have that kind of surface knowledge on your own, and then the therapist should be able to explain to you in depth what the treatments do for you.
Okay, that's awesome. I never knew that. So that's a good point that you put in there, because I never knew there was so many different variations of therapy that were, kind of specialized for specific individuals depending on, what they need help with, or what their, what assistance is needed. So this next question kind of goes hand in hand with what therapy looks like, or what therapy, or how do you know it's working? So this next question is, what does therapy look like? Now, it's one thing to implement what you're learning, but how do you know what it looks like?
So, I think we've touched on some of this just in our conversation. And therapy looks like you being open and trusting of the process, of the therapeutic process, right? You can say that, oh, I think I need therapy, and go meet with a therapist, and you're not open. You don't try to do the things that you are being taught in therapy. You kind of live the same rigmarole, daily things. You're continuing to do the same thing. So therapy looks like you doing the work, you being trusting of the process, being open to the process, and engaging in the process. And then in terms of the therapist, what you could expect is a lot of questions. We love to ask you questions, and that's to get you to come to conclusions yourself. I'm of the belief that everything a person needs, the answers that you need is already inside of you. You may have just had experiences, traumas that suppressed what you know about yourself or what you know to do. And so what you need, you already have. So it's my role to bring up those things that you already know and ask the right questions so that you get to that space.
Okay. And I like how it has a whole strategy to it. You know what I mean? I like the fact that when a therapist is actually asking you what you need, you almost answer your own questions. Mm-hmm. You know what I mean? Mm-hmm. It's almost like you go in there with a set mindset. All right, I'm gonna go in here. I'm gonna just say how I feel about stuff. But there's actually a strategic way that it's done, at least from my experience. Uh-huh. There's a strategic way that it's done. And then a lot of times I'll be thinking to myself, like, dang, I just answered my own question. Or that's why I've been feeling, or that's why I've been saying, or this is why, such and such is happening or going on. So yeah, I always get that epiphany, like, dang, okay, yeah. I get it now. I got it. And then I leave out of there feeling a whole lot lighter.
Absolutely.
Than what I did when I went in. Okay, yeah. So my next question is, when should you start therapy?
Kind of going back to, I'm going to start with trauma first. I would say as soon as possible. As soon as you have experienced a trauma, seek therapy right away. Like we've talked, like I've said probably a million times already, those experiences shape who we are, how we react, and the things that we do. So the sooner you can intervene, talk about it, heal from it, the better.
Yeah.
It's just like having a medical illness, or if you broke your leg doing something, you're not going to wait weeks to go get your leg checked out if you broke it.
Exactly.
You're going to report immediately to the emergency room and be seen to get your leg fixed. So the same for issues and experiences and traumas that we face. Now, if it's been years, sometimes we've had experiences and years later, they start to affect us. Years later, it's triggered by something else. And you're like, oh my God, I haven't thought about this issue or situation in years.
A long time, yeah.
Yeah, but because something happened and it triggered it, now all these emotions and thoughts and feelings are coming up for you. I would say that's a great time to seek therapy, no matter how old the trauma is or how old the experience is. It truly is never too late to work on it. But when it's fresh and new, it's best to work on it as soon as you can.
I like that. I feel like it's really good I agree with you, because I feel like when it's raw and when the emotions and the feelings are already there, I think you can get more of a handle on it versus waiting until it's built. Or like you said, waiting until something else happens. And then here you are, you got both of them now. You got this trauma that you never dealt with, this trauma that just happened. So I agree with that. I think it's important to seek out therapy, or go see someone or talk to someone when it's raw, when it's fresh, when the emotions are still high, when you can still articulate the way you feel. And you're not confused and you don't know what's going on, or you just have so many emotions that you don't even know if you're going or coming. So, yeah, I think that's important. Okay, so here's one. And I thought this was really important because we mentioned earlier about therapy not being really something that is expressed a lot in the Black community because of various reasons. But do you think that it's needful for the Black community to talk to a therapist or seek a therapist or, sit down with a therapist?
Absolutely. Absolutely. And I think that there are layers as to why. We think, culturally, we've experienced slavery, Jim Crow, we still experience discrimination in the workplace. The past few years, experiencing injustices in terms of policing, a long history of injustice when it comes to the justice system itself.
Right.
So absolutely, could Black people benefit from therapy? Yes, to deal with those, that long history of things. And then you can break it down further to your family. There's, long histories of things, violence, rape, incest, all these different things that happen within our family that we don't even talk about, that sometimes brushed under the rug. What better way to talk about those things than with a licensed professional who can help you work through those things? And then even further, individually as a person experiencing things within, yourself.
Mm-hmm.
There is self-doubt, issues with self-worth, self-esteem.
Yeah, some good stuff.
Yeah, those are all things on an individual level that you can work on in therapy. So my answer is yes, yes, yes. The Black community can definitely benefit from therapy.
I agree with that. One thing that really bothers me the most is that I always feel like us as a Black community is always the last to do stuff.
Mm-hmm.
You know what I mean? Does that make sense? Like we're the first to jump to do certain things, but we're the last person to do things when it's important. Life insurance, therapy, saving, all of that type of stuff. Like, and that's not for all Black people. That's, that's not for the entire community. That's just for some of us or a portion of us or percentage of us. But I feel like we're always last to do stuff. Mm-hmm. And I don't know why. I feel like it could probably be various reasons of why we just drag our feet on so much stuff. And then the stuff that's important or the stuff that we need to take advantage of, we just don't. Or we're the last ones to find out how, beneficial it is to us. Because I think that's the key. As long as it's beneficial, I'm all for it. As long as it's beneficial, then, I'm jumping on it.
Right.
I'm here for it. So that just bothers me that we're always the last culture, the last people to always want to, that are always last to do things that are so important to your physical health, your mental health, all of that type of stuff. So I just want to put that in there because that makes me so mad.
And in response to that, I think a piece of it is for us as a culture, we think about the messages that we get as Black people. We're supposed to be strong. Nothing is supposed to bother us. We're supposed to work through it. We're supposed to pray through it. Not that there's anything wrong with praying, but you gotta also include therapy along with your prayer, along with going to church. Those I always say God and therapy, because I think religion is also one thing that keeps Black folks from doing therapy. We just gotta fast and pray and God will fix it. But the word says faith without works is dead. So you still have to do the work along with still trusting God that He will deliver you and bring you through.
That's it. I definitely agree with that. That goes hand in hand because it's definitely important. Okay, so my next one is, how much is therapy, or how much does therapy cost?
Sure. So it ranges from, I would say the average cost for a therapy session is around $100. It can range from 65 all the way up. Some people charge $160, $175 per session. It also depends on region as well. I'm not sure how far your podcast reaches, but maybe if you're on the coast, you're going to pay more, because cost of living is more expensive and things are just more costly on the coast. So I would average Midwest cost, I would say about $100 per session. Now, if you have insurance, most insurance carriers have a mental health benefit that you can take advantage of as well. You'd have to find therapists who are paneled or who accept your insurance, but you also use your insurance as well. You can use health savings accounts.
Oh, cool. I never do that. And I have one of those.
You can use your health savings account to pay for therapy. Some FSA accounts you can do therapy. You just have to check and make sure that that's something they'll reimburse you for. But you have to be creative and find ways to be able to pay for the cost. But I will say, as a people, we do figure out ways to do other things. So why not figure out a way to pay to take care of your mental health?
I definitely agree with that. That is one benefit that I love about the company that I work for, because they actually give us 6 free sessions of therapy a year. And, anything after that, of course, you have to pay, or like you mentioned, see what else they'll cover through other outlets, FSA, HSA, you know, insurance, that type of thing. So I definitely took advantage of them 6. Okay,
Yeah,
let me get them. And the only thing that they required is that you go with somebody that's in network.
right.
It was that simple. I said, okay, well, I wish I had known this earlier. I definitely would have taken advantage of it, but it's something that's renewed every year. And I try to take advantage of that. So I'm glad that that's something that is meant, you know, that's a part of the company I work for. Okay, so here's another one I got for you. How do you choose your therapist?
That's a great question. Here's what I would encourage you to do if you're interested in therapy is for you yourself first to sit and really think about what it is you want to get from therapy, right? What are your goals? And then as you are searching the various websites to find a therapist, whether that's Psychology Today or therapyforblackgirls.com, Google, whatever it is, then you can kind of read the bios on those therapists and kind of compare notes to the list of things that you have written down to see if that person would be a good fit. And then once you take the step to reach out to that therapist, before you even schedule a first session, you can request a consultation with that therapist.
Oh, wow. That's awesome.
Yeah. Like I myself, I do free 15-minute consultations, and there are lots of therapists who will do free consultations.
Okay.
And that is 15 minutes for me to tell you about myself, what qualifies me to be a therapist, what treatments I provide in therapy. And then that's the opportunity for you to ask me any questions as well. So I would, if you're unsure, that's the best way is to schedule, you know, request a consultation to meet the therapist first before you decide to engage in therapy with that person.
Awesome. So I have another question for you before I get to my last one. This next question is, how do you choose your clientele? Because there's a way that we choose who we want as our therapist. So how do you choose your clientele?
Sure. So me personally, I would say my specialty is people with chronic disease and caregivers.
Okay.
However, my clients run the gamut of mental health diagnoses or experiences or traumas. So for me, as long as I feel like I have the skills to be able to treat you, then I will accept you as a client. Now, for example, there are types of experiences that is just not my expertise, and I would be doing you a disservice to say, yes, come on, girl, come on, man, let me do therapy with you, and I don't have a clue how to treat somebody with an eating disorder, for example.
Right.
So as a therapist, we all have to be diligent about not taking clients that's out of our scope of practice, right? And so I try to keep a referral list of, you know, if I can't meet your needs, here's a list of people who might be able to help you.
Okay. That's interesting. I've always wanted to ask that question. Okay, so my last question for you is, does therapy help with your mental health?
Yes. That's in fact the reason to attend therapy, right? You want to be as mentally healthy as possible. And that's so when you do face hard situations or traumas or experiences, you have this safety net already to be able to go through and deal with those situations as they arise. You know, for example, if you are already in a deep depression and something traumatic happens to you, guess what? You're going to have a really hard time dealing with that incident versus if you've learned coping strategies, if you're on the proper medications to help you, if medications is a thing for you to treat your depression and something happens, you're better equipped to handle that situation.
Okay, that's awesome. I know that mental illness, mental health in general is just something that's so important. And I feel like as the years go on, as things continue to happen, there's so many other things that are going to weigh on your mental health. And so I think therapy is another outlet, is another way to relinquish some of that mental stress, that
Sure.
mental heaviness, that's on you. So I take well advantage of all that good stuff, the tools, the conversation, the atmosphere of, being in a therapist's office. And I always take something from it.
Oh, good.
That's how I know that, I'm in a session with a good therapist, because I always take something from it. I'm always learning to do something different. I'm always learning how to, implement a different plan or a different way of doing it, or to restrain from, reacting or doing things the way I would normally do it. And so I'm here for all these questions. Thank you so much for answering all of them. Is there anything else that you would like to mention about therapy in general that we have not either talked about, or something that just kind of came across your mind that you want to mention?
Mm-hmm. I would just say, if you're thinking about it, do it. Try it. Try a couple of sessions, see how it works for you. A lot of times, some of us are on the fence. I can't tell you the number of times I've had a client schedule and then cancel because they were afraid, and then they rescheduled. They had their first session and they're like, whew.
Yeah.
That's
Wasn't
not
that bad.
Right, exactly. That's not what I expected. That's not that bad. And so just try it. Try it out. The key really is also doing the work and finding a therapist that best fits you. Just because a therapist worked great for your friend doesn't necessarily mean that's going to be the best therapist for you. So do your research, talk to people, and figure out who's a good fit for you.
Definitely. Well, Miss Johnessia, I want to thank you so much for being a guest on a podcast with me today. I definitely got some nuggets. I got some important information. I got some things that I didn't even know about therapy in itself that I kind of took away from today. And the next time I go see, my therapist, I will definitely be asking some of those things and kind of, picking her brain a little bit about some things that I would like to address or go more into detail about. So if anybody is interested in talking to a therapist, seeing a therapist, having a conversation with a therapist, even doing a consultation to see if it's something for you, Ms. Johnessia, tell the people where they can get in contact with you.
Yeah, so I am on Facebook and Instagram, Convergence Counseling on both. My number to the business is 816-775-0702. And then you can always also find me on my website, which is convergencecounselingkc.com. I have a bio there, kind of talk to you about my services there as well. And you are able to email me through that website as well.
Awesome. I'm so excited. I hope that whoever listens to this, whoever tunes in, that they definitely reach out to you, because I know you got definitely some good stuff to offer. So I am so excited that I had the opportunity to get to speak with you today. Thank you so much for taking time out of your day to come and chat with me about the importance and the benefits of therapy. And listen, this is it for this video. Thank you so much for tuning in to the Queen's Lounge podcast. If you are not, you need to be following us on Facebook.com. We're also on Instagram. Wherever you listen to your podcast, we are there. We're on Spotify. We're on Apple Podcasts. We're on Castbox. We're on Pandora. We're on all that. So wherever you listen to your podcast, you are there to listen to the Queen's Lounge. Thank you so much for tuning in. Miss Johnessia, it's been a pleasure to talk to you and see you once again. And this will not be the last time you hear from me.
Yes, ma'am. Thank you so much. I appreciate you.
No problem. Thank you so much. I appreciate it. And I will talk to you soon.
All right. Bye.
All righty. Bye.